Hey everyone, it's Matt with iSimulate. Wanted to spend a few minutes today reviewing the process of building a scenario in Reality 360. You can accomplish this on multiple devices. However, I've found it easiest to utilize the iPad 12.9 monitor iPad connected to a Bluetooth keyboard to be able to create content and officially enter information into your scenario. To start, we're going to navigate to the control icon on the iPad running Reality 360. Once we've opened Reality 360, we're going to navigate up to the hamburger menu in the top left corner and select New Scenario. I always begin by entering my scenario information using the eye at the top of the screen, and today we'll call this STEMI cardiac arrest. You can select the default monitor that you'd like to use to run this scenario. As long as it's within your license agreement, you'll be able to do that. And you can always change this later. You can select a default runtime for your scenario, default pacer, enter a patient's names. You could select an image if you would like of said patient from the quick picks. Gender, age can be selected here using the plus button. Weight, especially necessary if you're utilizing a ventilator module along with it. And then you can add more information, including your story. So today we'll talk about a patient complaining of chest pain to keep it simple. You can enter clinical course or discussion points, especially if you're using this as a review tool for a case that's previously occurred within your organization. We'll click update at the end and begin by starting with our initial events. Clicking the pencil in the events tab will allow us a note. And again, you could add in more information as a reminder to the facilitator or to be displayed on the monitor as we're going to do today. So 46-year-old male complains of chest pain times 3 hours. We're going to select the display on monitor and have it display for 2 seconds when we get going on our scenario. I'm also going to ensure that all of the eyeballs are off for this particular text box. We'll add our initial set of vitals, titling them Initial Vitals. And we're going to have these trend for 45 seconds as the patient is going to be identified and deteriorate rapidly. We'll set his initial heart rate to a target of 105. Close the eyeball off again so that these channels won't be displayed when the monitor powers on. Or alternatively, you could turn the lead selection off so that a dotted line is just reviewed by the participants when the monitor turns on. We'll give him a hypotensive blood pressure. And we'll make him slightly hypoxic for this initial set of vitals. We're not going to enter any end title yet because it won't be applied this quickly for this particular patient. And then we'd like to add a checklist item over here on the right side, adding a new one, and we'll call this Assess ABCs. We'll make it a check yes or no item. You could also select a grade or a non-critical item for this. And then we're going to link that by clicking on checklist and closing it, clicking on checklist and selecting that checklist item so it's highlighted so it will display linearly as you progress through. You also have the ability to add in media and labs, which we'll do in an additional waveform. Our next set of vitals is going to be decompensation. And we're going to change the waveform from a sinus wave to an ischemic wave with an inferior STEMI occurring. Increases heart rate again, set our O2 saturation as declining, make him additionally more hypotensive. And at this time, we could select and offer an end tidal reading to our participants and a respiratory rate as we go through. I'm going to turn this one off in the programming so that if by chance the participants haven't applied end tidal monitoring to the patient, this will not display for them. We're going to choose to jump to next on this particular text box after 1 minute so that the participants will automatically progress through. And under checklist items, we're going to add a new checklist, clicking the plus, and call this ACS evaluation, EKG, vitals, as those would be the two tasks that we would like accomplished for this particular box. I'm also going to add one in here just for aspirin administration and add one in here for nitrates, if those were important steps. Again, clicking on checklist on the left after we click the checkbox, and then selecting the checklist items that we want associated with this particular set of vital signs or quick pick. As it's going to automatically progress through, we'll allow that decompensation to run, and we'll call this one loss of pulses. And the patient is going to progress into a VTAC rhythm with no blood pressure, no heart rate, no end tidal running. And I'm going to leave this one off as well, just for this particular scenario, but you could have it progress through. We'll add a new checklist item as well at this time called Identify Cardiac Arrest. And click Update, click the check mark, and again, Checklist, and then Identify Cardiac Arrest. Click Update. At this point, you have choices of how you want it to progress. We'll add this one into making it simple with ROSC. And actually, before I do that, I realized that under lost pulses, I forgot a checkbox. So I'm going to click on lost pulses, and under shock, jump to next, enable the defibrillation responsiveness so that when the patient is defibrillated, it'll automatically advance to our next tab. Now I'll add in the ROSC box, and we will make him a sinus 2 waveform, and we'll give him some SpO2. We'll give him a blood pressure, and we'll add in some respiratory effort, and then tidal CO2. And just to make it a little bit more consistent, we'll actually go back to ischemia and leave him in that anterior inferior as if the MI had progressed further for him. Update. We now have all of these items listed in here. If we wanted to add additional information in, we could. And so if we wanted to program a lab value, we could come in and click on the labs tab, click add, come down, and let's do a cardiac panel. And we'll increase his troponin I. If you want to see what the normal values are set at, you can click on the little caret in here. This is stating the normal range is up to 0.04, so we've significantly exceeded that one. We'll check the troponin T as well, and we're going to increase that value using the plus button to a significant value. We wanted the labs to be displayed under the ROSC tab. We have a couple of options. First, we'll select the check mark to save it. We can go back in and edit ROSC by clicking the pencil, click on ROSC, scroll down to labs, and then click on your laboratory panel so that it'll highlight at the point where you are ready to display it for the students. After we've done this, just quick setup, we maybe want to add in some imagery or some other information. So we can select the media tab, click the eye. We could also add in a chest x-ray for this patient, and let's do a chest x-ray, and we'll just come back to a image for this particular case with some mitral stenosis. We're going to click the checkbox. If we want it to display on the monitors automatically, we'll go ahead and turn that on. And we're ready to save our scenario by coming up to the hamburger menu, clicking Save Scenario, ensuring the name is correct. If we want it added to a folder, we can certainly do that, or add it to the main list of scenarios. I've gone ahead and opened my control iPad since I wrote the scenario on my monitor iPad, and now need to transfer that scenario over to the control iPad to test the scenario and perform any needed edits to it. This process can be completed by navigating to the control option on your control iPad, and on your monitor iPad, after we've saved it, navigating to the hamburger menu and then opening the library. We'll do the same thing on the control iPad by navigating to the library and then clicking the sync button on both devices, making sure they're both connected to the same local area network. On my monitor iPad, I'll scroll down, locate the scenario I just wrote, select it, and we'll see that it's available to accept. Because I've already saved this once, you'll notice that it's warning me of a duplicate. I'm going to go ahead and overwrite it and click OK. I can now exit out of the library on both iPads by clicking the X. And then on the monitor iPad, using the hamburger menu, we'll go ahead and exit to menu. We're going to go ahead and select the scenario we want to run on the control iPad by clicking on the hamburger menu, scrolling down to the bottom where our scenario is listed, and selecting it, clicking tap to connect, and then connecting our control iPad to our monitor. It'll once again ask us to select the scenario we want to run. And now we're ready to go with the default generic monitor in. If I wanted to change this dynamically, I can click on the monitor button, select the picture, and then select the cardiac monitor I'd like to use for this scenario. Or if I needed to edit it, I could open the eye, select the monitor picture, and then resave after I've changed the monitor type. We'll go ahead and start the scenario, and we'll notice that when we click on the 46-year-old male, it shows the initial statement. We'll power the monitor on as we click the initial vitals tab. And then as the patient is connected to all the devices for monitoring, we'll see those appear. I'm going to go ahead and bring our volume level down a bit for our purposes. And because we trended this over 45 seconds, this heart rate is going to accelerate up to about 105. When we're ready to progress through the scenario, I can click on decompensation. Again, the ECG will change, the SpO2 has changed, and after 60 seconds, because that's how we set it, it's going to automatically advance into the cardiac arrest portion of this scenario. When that occurs, again, we're watching the timers on the bottom, which are just a reference. They don't create a hard stop, so you can always exceed the time if necessary. We'll see the ECG rhythm change, and the providers will need to initiate the appropriate responses. As we had some checklist items highlighted as well, we'll notice that we skipped over the assess ABCs for the initial one. We can go back and say, yes, they did it. And then maybe make a note stating missed auscultation. And save that along with the log. At this point, the patient's rhythm has converted. We would expect them to initiate CPR, which if you're using a CPR module, will give you real-time artifact feedback, or the facilitator can select the CPR button to emulate a CPR artifact waveform. As that's progressing, the facilitator can go back and re-edit the checklist items. They didn't have time to do an EKG or aspirin or nitro during this scenario, so we'll just fill those in now, knowing that they have to identify cardiac arrest, which they did. We'll speed up time a little bit and say that they're ready to pre-charge their monitor so that it's ready to go as soon as they're ready for a rhythm check. We'll pause CPR by unselecting the CPR button on the control iPad, evaluate the rhythm, deliver the defibrillation, and we advanced right into the ROSC scenario where we had programmed labs to be evaluated and automatically display. I'll tap close to get rid of those right now. And now we could perform a 12 lead. As the generic monitor doesn't have an acquisition button on it, the alternative is to utilize the advanced menu in the heart rate box. Clicking on that, navigating to the electrode placement section, and click Send 12 lead to display on the participant's monitor screens for review. They can X out of that at the end, and when you're done with your simulation, simply click Stop. If you've made any changes to this scenario that you needed by editing, I would say no, and I would come back up to the hamburger menu and click Save Scenario again to lock in any changes you made. Repeat this process until the scenario is running the way you want, and then bring it out and test it. I hope this has been a helpful introduction to creating a basic scenario on REALITi 360. For any questions, feel free to email us at education@isimulate.com or visit our knowledge site with a link on the screen. Have a great day.